Okay, now the patient is plugged in and the study is running. The first thing that we're going to do now is do device calibrations. And that calibrates the equipment. It'll run across a 30-second screen here. And now that's completed and we start to see our waveform coming back. So now we're going to do our impedance check. We've now done our impedance check to make sure that all our wires are functioning correctly. And now we're going to start with our patient biocalibrations. The first calibration that we're going to do here with the patient is we're having the patient make sure that he maintains and keeps his eyes open. Okay, going to start with your calibrations. We need you to lie on your back and have your eyes open, please. And mainly the light purple at the top of the screen is the patient's eyes. Okay, now we're going to have you close your eyes and keep them closed. Again, the light purple at the top of the screen is the patient's eyes. I'm going to have you open up your eyes. This is eye movement only, so do not move your head, but with your eyes, I need you to keep repeating the pattern of looking up and down, up and down. Again, this is eye movement, the light purple. Now coming into the screen, you'll start to see the patient's eye movement up and down. Great, and let's change that eye movement to left to right, left and right. And now coming into the right of the screen, you can see the patient's eyes moving left to right. Okay, I'm going to ask you to blink your eyes 10 times. You can see the waveform change again. Patient blinking their eyes 10 times. Now have you noticed the hot pink? That is the patient's chin leads. I'm going to ask the patient to bite down hard so we will see all the head leads and the chin leads show that amplitude. Let me have you bite down and grit your teeth for me, please. And that should be coming up right through the screen. And here it comes into the view. Okay, relax. Take 3 deep breaths in and out through your nose only. Now you'll see that come into the bottom of your screen. You're seeing the patient's flow at the bottom of the screen. You'll see the amplitude go up. And now I need you to breathe normally in and out through your mouth only. And again, at the bottom of your screen, you're going to see the belts and the patient's flow, showing breathing in and out. When you're ready, I need you to take a deep breath in and hold it for about 10 seconds or as long as you can. And again, if you keep it to the bottom of the screen, you'll notice that the flow ceases and all belts remain flat. That's showing that the patient is not breathing. It's coming into the screen bottom right now. Excellent. Go ahead and start breathing, and you'll see the waveforms start to come back. Now, if you look to the orange on the screen, those are both the patient's right and left legs. I'm going to ask him to please flex just your left foot for me. And you'll see that come into screen. And there it is. There's the amplitude of his left leg. Okay, let's stop and switch to the right leg, please. And now you see his right leg coming into play. Okay, go ahead and relax. If you notice the green underneath the orange, that is the patient's snore monitor. Please give a fake snoring sound if you can. And you're going to see that come into play. Great, thank you. Last thing here, this is paradoxical breathing. I need you to take in a deep breath, hold your breath, and push your stomach muscles in and out over and over again like you're attempting to breathe. And if you'll note, the flow goes flat right here, and you'll see the belts still moving for the patient trying to breathe. Great, go ahead and breathe. Okay, and that's what does patient calibrations. So now we just start the patient study, and they're all set.